And obviously, in order for us to do sequencing, we have to have somebody present to be tested. And what we do know is that testing tends to ride with the epidemic curve. In other words, as more people are experiencing illness, more people come get tested. We also know, though, that there's a bit of fatigue, right? Whether it's with the vaccine or testing or whatever, there's a bit of fatigue with the effort to control the epidemic, or fatigue with the epidemic. And so what we want to remind people, and that's part of why we had Dr. Lieberman here earlier this week, is that at this time of year, a lot of people tend to experience some sort of respiratory difficulty because of the change in the weather, or they have an allergic reaction to something. And we don't want people to mistakenly believe that the symptoms they're having are somehow just normal. If you're having any sort of symptoms of sore throat, achiness, headaches, shortness of breath, fevers, those sorts of things, those are not allergy symptoms. Those are not normal. And we want to just keep reminding people that we've made a huge investment here in Shelby County. In fact, Shelby County and Davidson County are the two most heavily tested counties in Tennessee. So we've made an investment of resources and partnerships to make sure that if you need to be tested in Shelby County, that it's easy to do. And not everywhere in Tennessee is that true. Not everywhere in America is that true. And we are committed to maintaining that capability. So even as the vaccine campaign became the focus beginning in December, we have maintained almost 17,000 weekly community-supported test sites throughout Shelby County. And we continue to do outreach testing events like the two pop-up events that I mentioned earlier. So we're committed to testing. We're committed to testing so that people can find out if they have COVID and they can isolate, or we can identify their contacts and quarantine them. We are also interested in the sequence results. So during this week, in addition to seeing all of the UK strain variants, the B117s, which is the predominant strain, we've detected some evidence of a strain out of New York. We found another introduction of the P1 variant from Brazil, and we've had a single case of a South African strain. So we do need people to get tested so that we can identify those variants with public health concern and respond to them with our priority investigation teams. But across the board, the main reason to get tested is so that you can identify for yourself, do I have COVID? And if so, let me isolate and protect my loved ones, my friends, my coworkers. But also, let's be aware of the signs and symptoms of severe and worsening disease that may give you a signal you need to go to the hospital. So all of those things are made easier to do if you know for sure what your status is, and that's why we want people to keep testing.